Okay, thank you very much. Can move on to Frank.
Thank you, Ida. I don't have any slides either, although Bartha was kind enough to show a number of the slides from our model that she showed in her presentation, what Glenn referred to as so-called the GSK model. I know people have seen that at this meeting and others, so I'm not going to go over it in detail, but try to give you an update. And one of the things that Bartha said that I really do support is having multiple sponsors with a global presence really do help in this effort to understand the global regulations. If you focus just on U.S. regulations or just on one way of doing things, I think it's a short-term project. I also give a lot of credit to Harlan, who has been extremely open in talking to us over the last close to a year and a half, sharing policies, and it's really helped us learn, and I hopefully the opposite is also true. The so-called GSK model, as Glenn said, is really an outgrowth of a 11-year project. In 2003, I was told, we've got a project for you, be about 6 weeks long, figure out how to disclose our data. So long 6 weeks. I was reminiscing with Deborah Zarin over lunch that it's only probably 8 years ago that Jeff and I were sitting in a room not too far from here, and Ida and I were sitting in a room in Geneva debating the 20 elements to be posted on clinicaltrials.gov for a protocol. So we have come a long way. I think the release of clinical trial data is sort of an inevitable evolution on the trajectory of disclosure, but is a huge leap in complexity. And I think that's what drives a lot of these discussions. We started working on this in 2010. It took us several years to get through some of the complex issues. So one friendly amendment to Bartha's comments, this model was not in any way driven by the EMA legislation on clinical trial release. In fact, EMA consulted GSK on considering using our model before that legislation was ever written. So I just wanted to set that straight. The long-term goal, our long-term goal remains to have one central custodian of the information. We don't really want to be in this business. We'd love to be able to turn the information over. There are many practical reasons why that's difficult. Harlan's mentioned some of them, others have, around standards and informed consents and many data privacy issues. We have moved to a multi-sponsor site. So last year when I was here, GSK was the only sponsor on the site. It's not GSK's site anymore, it's a multi-sponsor site. We have 6 sponsors. GSK has about 670 trials on that site. Hopefully by the end of next year, it'll be about 2,000. The other sponsors are gradually ramping up. And I don't really want to get into a lot of details, but there are a lot of questions this morning on resource and what does it take to do this. So I thought I'd quote a couple of pieces of information. I don't really have any idea what the financial costs were to generate that site. But in terms of people, it's probably going to take us about 15 to 20 full-time equivalents over the next couple of years to get all of our trials back to year 2000 on that site. We estimate it'll take about 4 to 6 people as a sort of a steady state maintenance. And again, that's just for, I can only speak for our trials. A lot of that depends on how far back people want to go. We have trials on our site, but you can request any trial. If it has an NCT number, you can enter it. And if we can find it, we'll disclose it. If you want the original trials for digoxin or lithium, we might have trouble coming up with those. But anything in recent history that's reasonable, we can probably find. So it's not a trivial effort, but I don't think it's overwhelming. We have, I think, negotiated a nice interaction with the SAS Corporation in terms of setting up the site. They do have a sliding scale of fees for large institutions, large corporations versus nonprofits and smaller academic institutions, which helps sort of people get, the threshold to get involved. And we're hoping that will take place. It is difficult to estimate the number of resources. So the openness and the governance, which was discussed a little bit in the last session around the independent review panel, there was a lot of debate on this last October and earlier in some meetings last year. We have been running the independent review panel, which Bartha mentioned. She sits on it. And we believe that's important to minimize bias and maintain credibility. I think Harlan covered those issues. It's a high-level scientific review. It's not really a filter The independent review panels only turned back one proposal, and that was really just to get more information. We've had over 100 inquiries. Only 2 have been denied, one because somebody wanted non-anonymized data, which we felt wasn't appropriate, and one was on a drug that was still in development. But all the other inquiries have gone through, ultimately, 2 proposals to the review panel. We're working hard to modify the independent review panel. We're actually actively engaged with the Wellcome Trust to set up a system where they would now inherit and take over and manage the independent review panel. We've talked to many stakeholders about the possibility in getting involved in that. The next step would be to find an independent custodian that would want to deal with the operational characteristics. That's a whole different set of resources, a whole different kind of expertise, and we recognize that. But we view by the independent sponsor, for all the reasons Harlan and others have said, is absolutely essential. We don't want to be in the business of determining what is or isn't a valid scientific question. We do insist that, that whatever work is done is published, and we do insist that if the people do find safety issues that we didn't see, that they immediately report them to the government. Those are 2 of the issues, and of course they don't violate patient privacy. We've taken many steps to prevent that, but of course it's not, as you know, not impossible. From the logistics piece, and this is, I think, where I think the next hurdle that we need to overcome, and this was mentioned earlier in the day, until we get to a point where everybody's using some sort of commonly accepted interoperable standard like CDIS, we are going to be forced in the situation of trying to put all of these things in one box. If we had a reasonable interoperable standard, we wouldn't have to have one repository of information. We'd have the ability to communicate and combine information from multiple places, but that's not where we are today, and it is an issue. So interoperability is the key. The other piece of that is some standardization on de-identification, redaction of CSRs and documents. That takes an enormous amount of effort. Nobody likes to talk about it, but it's an enormous amount of effort. And in fact, if people could evolve to having a standard way of doing that, we spend a lot of time on redacting CSRs and all sorts of protocols, any textual document databases. It's an enormous effort. So driving someone to come up with a standard, I think, would do this global effort a huge favor. I mean, in the end, I think Bernie mentioned the importance of publication. This is all about transparency. So we're asking people to get access to data, and they're going to do something. They should make what they do transparent. And so that's the only, I think you asked the question, Bernie, about how you're going to improve outcomes in the long run. Well, step 1 is telling people what you did. I mean, in the end, the solution here is, it's not to overly trivialize it, but finding a way to easily archiving and accessing something. And that's easier said than done, but that's the challenge here. It's not, there's obviously a lot of people who have different opinions about whether we should or shouldn't do it, but I obviously strongly believe we should. But as Harlan said, this is not an effort, this is a journey, and it's something you're going to hit a lot of hurdles. And every day we hit another hurdle, and we just sit down and try and figure it out. So it's, there's 1,000 reasons you can come up with not to do this. But there's just a thousand problems you have to solve. So look forward to the discussion.